Welcome back. Wisdom teeth are the last adult teeth to come into the mouth, but sometimes it remains buried in the jaw, causing problems and pain. It's called impacted wisdom tooth or impacted third molar. This is the topic that will be discussed now with our special guest, Dr.Hossam Shash, face and jaw surgeon. Thank you so much, sir, for being with us.
Good morning, doctor. First of all, it seems like a very complicated name, as Hind mentioned. So if you can give us a definition that everyone understands about the impacted third molar and the wisdom teeth.
Okay. Impacted third molar is the last molar which usually appears in the oral cavity in the mouth. Sometimes it appears and sometimes it's not appearing. So in this case it is called impacted. This impaction means that there is some obstacles which will cause the difficulty in its appearance. Sometimes it's partially erupted or it is totally it's partially impacted or it is totally impacted. Partially impacted means that there is sometimes part of it appears in the oral cavity and another part doesn't appearing in the oral cavity. While completely impacted means that the molar doesn't appear completely in the oral cavity, and in this case it's called a bony impaction, where the first type where part of it appears is called soft tissue impaction. Usually the wisdom tooth or molar appears between the age of 17 to 25 years old. So it's called wisdom. This is not a perfect definition for it, but sometimes it is mainly called the third molar, impacted third molar, but it's commonly used now as a wisdom tooth. This is a simple definition about the third molar or the third molar.
Okay, what about the causes? You mentioned that some appears erupt or appear, others stay inside.
Okay, we can classify the causes of impaction into two main causes: local causes or systemic and general causes. The local causes, one of the main causes of this is the presence of inadequate space. That's to say, we have a short or a small jaw in compared to the space we need to erupt this molar. This is now due to the use of soft diet. People now use soft diet, so the growth of the jaw is not normally. It's
diet
small.
At what age?
Sorry?
Diet at what age? At this early age?
The age of growth, yani about 12, 13, 14, this age. Usually it erupts at the age of 17. So when nowadays they are eating always soft diet, so the jaw doesn't grow so much, or it's difficult in the size of the jaw. Also there are other causes, the presence of any obstacle which make it difficult to erupt. Such as the presence of soft tissue present here in this area, or the rotation of the molar, sometimes as a result of trauma. Trauma will cause dilaceration or change in the direction of the root of this molar. Also, I want to mention that it have a unique character here, that it have different position. It may be directed towards the second molar, or it may be directed away from it. Many terms. I don't want to say the medical terms because it's sometimes difficult.
Could we foresee the problems? I mean, could we predict that the child, or I mean, prior to
yes.
Well, I mean, 16 years old, 16 or I mean, yes. 16 or 17, but prior to actually having the wisdom teeth come out, could we predict that they are going to have problems? How could we avoid having a problem with their wisdom teeth growing out?
Okay. Let me say something to continue the previous subject, that we have also systemic causes, not local causes, but not common. These systemic causes include some diseases like rickets, syphilis. These are diseases which may also cause impacted third molar. Also some hereditary causes, which is not common, but I also want to mention it. I will return to your question about the how to expect that there is a problem related to this molar.
And if we can avoid the problem.
Yes. First of all, usually Egyptian came to us in our clinics in pain. If the pain is related, if there is continuous pain related to this area, the area of the third molar, this is an indication which will let me spot that there is defect in this area, which means that there is defect in the third molar. Also, there may be defect including continuous swelling in this area, because the soft tissue which is present overlying this molar usually will swell. Sometimes there is a odor, fetid odor present due to the difficulty in eruption. Also, sometimes the patient feels inflammation in the surrounding area. I mean, here in the lymph nodes, there is also swollen lymph nodes, which give us an indication that this is a problem related to the third molar, and we must go on and check this problem. Also, sometimes the indication of the removal of the third molar may be due other problems, including orthodontic and orthodontic surgery. Sometimes people came to us and we feel that there is a crowding in the jaw. The crowding in the jaw is, we must have an indication to remove the third molar to complete the orthodontic treatment. Now you are talking about these causes and how to manage it. I first of all want to say that management of the impacted third molar have certain steps. First step, we must make a proper examination of the area, including this impacted third molar, and then we must make an X-ray. There are two types of X-rays, a small film of X-ray called the periapical X-ray and a panoramic radiograph. And this panoramic radiograph usually, in case of difficulty in opening the mouth, which is called trismus. And I have not mentioned that impacted third molar, usually patient came to us with a trismus. Why there is a trismus? Because the patient, there is fatigue and inflammation in these muscles surrounding this area, and the patient cannot open this mouth. So I must first of all make proper examination, and then we must make X-ray to determine the direction of the roots, because this is a unique characteristic about the impacted third molar, that it is usually have a different location and direction of the roots if compared to the other molars. Also, we must make proper, if we have now the decision to make removal of this impacted third molar. If we have a soft tissue impaction, which is the presence only of soft tissue, this have a simple management. Only we will make simple incision. Incision means that we will get the scalpel and make cut in the soft tissue, and we try to expose the crown of the third molar, and this is a very simple case. Sometimes the impacted third molar is bony impacted, which means that there is surrounding bone all around, and in this case we will make, first step, make this incision, and we will expose the molar, but in this case we must remove bone. Bone removal is usually difficult, and sometimes it's there are many complications, so we must.
Are there dangers or implications of actually removing the wisdom teeth?
Yes, there are many complications. These complications may be during our operation or following our operation. One of the main common complications during the is that we can make injury to the blood vessels present in this area. So usually a maxillofacial surgeon must have a proper knowledge about the anatomy of the nerves and blood vessels present in this area. For example, if we are going to deal with a impacted lower third molar, there is an important nerve called the inferior alveolar nerve. This inferior alveolar nerve is usually responsible for the numbness of the lip, and also there is lingual nerve which is responsible for numbness of the tongue. So if we doesn't make a proper surgery in this area and we have make injury or hurt to this nerve, this will cause a numbness to the patient in his lip and in his tongue, and it is a very, very, very difficult state, and he cannot withstand it for a time. So we must be very perfect during the management of this area. Also, there may be problems related to our work. We are using a handpiece. Handpiece is rotating with a high speed, and this high speed, we have a burr. It may cut the soft tissue or any surrounding tissue. So we must be very perfect.
Cautious, very cautious.
Yes, very conscious during this removal. Also, sometimes when we make great force during the removal of the impacted third molar, there may be fracture to the adjoining structures, maybe fracture to the second molar joining and the surrounding bone. Also, there may be fracture if we use an excessive force. So we must be very conscious during the use of our force. Can I continue?
Sure.
Yes, okay. This includes the problems or the complication during the removal. But sometimes, which is very common, and I want to spot in this subject, is the complications which will occur after the removal of the impacted third molar. Because many patients, if they do not obey my instructions in this subject, they will have this complication. First of all, there is a bleeding. It's common to have bleeding, but it's common to have bleeding for 1 day, 2 days. But if there is a continuous bleeding going on after a period of time, this means that there is no blood clot formation in this area. Blood clot must form in order to heal the socket and stop bleeding. If the patient have smoking or make many other things which will make difficult blood clot formation, bleeding will be continuous. Also, there will be swelling and edema. This swelling and edema is due to the patient have opened his mouth for a long period of time during our operation, and so there is muscle fatigue. So in this case, we must give the patient some instructions and some medications and some hot fomentation from outside to, if there is swelling, it will subside by this hot fomentation. Also, there may be dry socket. What's meant of dry socket? Dry socket means that there will not, this socket will not heal. It will not heal also because patient usually go on smoking and he avoid the blood clot formation from going on, and so there will be a dry socket. This is a very common complication, and if the patient doesn't follow up my instructions and cannot come back to me, it will may cause a great problem, sometimes lead to osteomyelitis. Osteomyelitis means that the bone will be inflamed and the bone will be eaten in the following period.
Doctor, we are running out of time, but I have a very quick question. Is it necessary that every person has 4 wisdom teeth or 4 third molars?
Sometimes we have a good chance to have our 4 molars present in our mouth. But some other times there be 1 or 2 or even the 4 molars impacted, not present in our mouth. And this is not common. Maybe some people have this and some people have this percentage.
So each person has his own case,
yes.
Unique character.
Yes, may be impacted. All of them may be impacted, and all of them may be erupting, presented.
Or is it possible not to have any wisdom teeth?
Yes. Congenitally missing lower third molar is common. But we must make follow-up, and I have said that.
Checkups and follow-ups with the doctor is the best way to go.
Yes, you're right.
Okay, Dr. Hossam Shash, face and jaw surgeon, thank you so much, sir, for being with us this morning, and very informative discussion.
And right now we're going to